I'm Dr. Bridge, I'm a chiropractor here, and I hear you guys tearing up the healthcare bill or building it up, either way. I have a lot of patients, thousands, several thousand patients, and a lot of them are concerned not with the bill itself, but what would you do to help us? Meaning, if you don't have an A+ private sector, or if you're not a Medicare, where are you left? Personally, I could afford health care, but I choose not to because I don't want another house payment, okay? I put money in the bank and I do it myself. But asking you guys, how would you change the health care, personally, other than tearing up the bill or building up the bill? And if I may say one other thing, I mean, I go to a lot of these town hall meetings, and you know, everybody beats up Medicare. I get a lot of older folks complaining. As a doctor, I don't mind taking Medicare. I don't mind taking a reduced fee. My problem is when you scrutinize everything I do, and if I don't cross a T or dot an I, I go to jail. That's the problem.
Let Mr. Bailey speak first so we can get to just make it Gerald.
All right, so we definitely have a problem in healthcare. There's no question about that. The question is, what's the cause of the problems in healthcare, and then how do you fix it? The bill only makes matters worse because it exacerbates the cause of the problems that we currently have. We got to this point, starting in World War II, when the government put wage and price controls on industry. But they allowed employers, because inflationary pressures were high, to offer health care as a tax deductible to them, or tax-free to the employee benefit. So now you have a situation in which an employer puts in an additional $1 in benefit, and the employee sees that, perceives it as an additional $1 in compensation. Whereas if they got that $1 in actual wages, the taxes would be taken out, it'd be perceived more as 60 or 70 cents of additional compensation. So that started skewing the problem so that our employers provide our health care instead of us providing it. That then led, because of the tax incentives, led to us going from insurance, which is there to protect you from financial catastrophe, in this case, deriving from a accidental or health-caused emergency or situation. So we went from insurance to actually prepaid medical. Now, if you went to Safeway or King Soopers and loaded up your shopping cart with all the groceries you wanted, went to the checkout, they checked it out, you swiped your United Healthcare card or Blue Cross card and paid a $20 copay, don't you think we would have a crisis in food affordability in this country, as well as an obesity problem? Of course we would. We need to put this back into the control of individuals and get the government out of the way. Prior to Obamacare, 50 cents of every dollar in health care was being spent by the federal government. There are examples of free market medicine that exist today. LASIK eye surgery, any of the elective surgeries, cosmetic surgeries. The prices go down over time, the quality goes up. That's what a free market does. It's doing the exact opposite because the government is interfering. And I remember when I was a kid, I went to the doctor, my mom wrote a check. Remember, we're not very wealthy people, the lower middle class, wrote a check when we were done. At the office, there was a doctor and his nurse/receptionist. That can't happen today because of the administrative costs that you just talked about, the burdens that Medicare and all the insurance companies are now placing on medical providers.
Other comments?
Number one, the healthcare situation in this country is horribly complex, and I don't think any of us can stand up here and write a prescription and fix it. But there are some fundamental truths in this. And the first one is just as Stephen raised, is that we don't pay directly for our health care. We don't have an investment in cost control as we do when we spend our money on cars or food or houses. Secondly, you have to look at what the federal government has done to health care in the last 50 years. Medicare, for example, provides, from all I know from my in-laws and my mother, that Medicare provides pretty darn great service to the older people in this country. The problem is that it faces trillions of dollars in unfunded liabilities that are hanging out there in the future. So as good as it is today, it's headed for disaster. Medicaid, on the other hand, is breaking the bank at state levels. It's a big cause of why states are having such budget shortfalls. And Obamacare expands Medicaid eligibility. Secondly, Doctors will pretty much take Medicare, but not all doctors will take Medicaid because they lose money on every patient. So this is how the government handles healthcare. I would rather see us all be able to handle it on our own with appropriate local societal support for those folks who need help. The federal government is the wrong place to do this.
Any comment?
Yeah, I think, again, what we did with healthcare reform is going to help people get off of government healthcare, pay for their own healthcare. Right now, with Medicaid, you have people that are locked into poverty because they rely on the government healthcare. I've talked to families, they're $9 an hour. So I can't take a raise to $9.50 an hour. I lose thousands of dollars in benefits. So what are we doing? We're replacing it with a sliding scale. So it doesn't click off on $1, it goes all the way up. So there's actually incentive for them to earn more money and get off of the government dole. That's what we're doing with healthcare reform. Preventing discrimination against people with pre-existing conditions. And again, it's not your fault if you have a pre-existing condition. I mean, I have a friend who has a 12-year-old kid and they had a seizure last week. I mean, that could be uninsurable their whole life, if it wasn't for this healthcare reform. I mean, this makes an enormous difference in making sure everybody has the opportunity to be insured. A lot of people with pre-existing conditions, they could work for a big company, sure, but if they wanted to start their own company, be a consultant, open a store, those careers were basically choosing between their life and their health care or trying to pursue that career. They're now insurable in this large pool. And when you talk about preventing pricing discrimination and exclusions on pre-existing conditions, the flip side of that is there needs to be some kind of mandate in place. Because if you just do the first one, people wait till they're sick to get insurance. If you tell me I can pay the same when I get diagnosed with something, I'll wait till I got diagnosed with cancer, now I'm going to get insurance. It's cheap. So you got to have the healthy people in the pool. So that's kind of the general concept. I think this will empower entrepreneurs, people who are self-employed. It'll be help reduce costs for small businesses, and it'll help get people off the government dole on the Medicaid side.